AKSARAPAK SRIVIRIYALERTKUL from King Mongkut International Demonstration School. So, let me start with a simple question. Have you ever visited more than one hospital? Almost all of us have. Now imagine that one hospital, you did a blood test, but then you went to another hospital. The doctor couldn't see the result. You had to do all the tests again. This is a common problem in Thailand, medical reports are stored separately in each hospital system. Fragmented information leads to duplicated tests and some longer waiting times and sometimes even incorrect treatment and a waste of money. This is not because of the doctors, but because of the system itself is broken. So how can we centralize the medical record in the way that is secure and also easy to use? So let me talk about some existing application in Thailand. So Thailand have the application like Mopom and HealthLink. Mopom is basically introduced during COVID-19 and the HealthLink is introduced under the Ministries of Public Health. Mopom is mainly managed about the vaccination and some appointments, and healthcare is mainly only connect some hospital. However, both of the applications don't even have allow the patient to upload their own document. So here is the innovation concepts and objective. So for the concepts, patient can upload the organized documents by date and type. Documents can request access using the patient national ID and some OTP verification like one-time password. And also all this happen inside the line because of most people in Thailand use line application as it is a very easy and common, even elderly can use in their daily. And the objective is that patient can control over their health records and allow the doctor to have a faster and accurate access to the complete histories, and also support the public health such as some reminders about health. Next is methodologies. So basically I did review, identify and design and also analyze. So for the reviews, as I mentioned earlier, I studied the existing medical record system in Thailand such as Mopom and HealthLink. And for identified, I basically try to highlight their problems and fragmentations like poor accessibility and also some lack and limitations. Moreover, on the designs for the framework for layouts, I basically sort out of what should it be inside the line so that it would make the patients and the doctors get easier access. And also I try to analyze the benefit and the challenges and the impacts of my innovations. So how the application works, basically patients during their consultation with the doctors, they can upload their documents after the appointment and those information will record in this date by date and type. And next, when the next month the patients visit to another hospital, the doctor can also easily request using the patient national ID and patient will approve it with one-time password within a second. This can securely view the past lab report. On top of that, patients can include some appointment booking and also some reminders about health and follow-ups and also some alerts about the public announcement like some mini campaigns. Here is the challenges, some privacy and securities and integrations with the IT system and also some government concerns about the age. Moreover, for the application, patient can control their health records and reduce costs from duplicate tests, and also doctor can save time to take more informed decisions, and moreover, public can communicate quickly and manage campaigns more efficiently. And in conclusions, so the concept of life-based is basically to address those fragmented medical records by giving patients some control and doctors can access those easily. although it is still an idea, I still want to expect some reduced duplicates or shorten the waiting time and improve treatment accuracies and strengthen public health communication. Thank you for listening.
Thank you very much for your talk. So I'm just wondering how safe or secure this system is, because if the patient visit multiple doctors, then they may have to share this line system, right? So security, in terms of security, how secure do you think this is going to be?
It will be, it needs to share the information with the line base, right? But still the government will be a bit control of that as our centers like systems. However, patients can control who can access those information by using one-time passwords, which is OTP. Basically, that is like only a few seconds after the second, those OTP and the password will get destroyed, which means that others can access. Moreover, it will record some people who access those and it will show up.
Okay, I see. Thank you very much.
Okay, you introduce like the EMR platform in Thailand, right? So what do you think is the advantage of the line-based platform over the current platform in Thailand?
So, as my innovation is about like using a line base, right? Basically, most of the patients already have a line, which means that people can access those easier. Like people don't need to learn and training some basics or like steps to use those applications that already existing. However, like line can very easily to use and also some like small training is already okay. And especially with the elderly, mostly people with the elderly like find difficulties on using those applications. So line are the more comfortable application for them.
So do you think the senior people, like in rural area, can also easily access and then utilize this app-based platform, do you think?
Nowadays, there's like most of the people, many people already have some their technologies such as phone and some iPad, right? But however, there is a rural area that is still lack of those. But in my opinion, those medical records can also still record in their hospital, but it may affect the rural areas. But however, the application, this line base will be developed to match with every persons in the future.
Okay. You mentioned that the current issue is fragmented medical database, and patients can control their data by uploading their own medical documents. But I think the patient may forget or lose documents, so wouldn't it be better if hospital officer or doctor directly upload the document to some central database after the patient visit the hospital?
Also like hospital record and upload by themselves.
So both hospital and patients can upload documents?
Oh yeah, I forgot to mention about that. Like the hospital can also upload, but it also need to access by the patient as there is some limitation and security. So basically patients and hospital are the two main, like the doctor can also upload because they are in the room, right? And together, the patients and the doctors can both upload their documents